Hello, everybody. If you could take your seats. We are really, it's hard to believe that it's been a day and a half of a great meeting. And we're really appreciative to all of you who've been here, who've contributed, who've been part of this effort. And, you know, this is our closing session of the public meeting. And I think before I get started with what will be, I think, a really exciting conversation, I just want to thank again our MIT hosts, Arlene Fiore and Brenda downstairs. And we have, oh, Alex, you're here. Do you want to come up? Okay. And Jenny Bradford, who's done so much to plan and implement this meeting. Thank you, Jenny. Thank you, Jenny. And we have a team of Wisconsin and MIT students who have been handling the AV and taking photos and giving directions and making sure everything runs so smoothly. So I won't call them all out, but maybe we can just say great job, team. You know, one of the themes of HAQAST has been connecting the billions of dollars, literally billions, of publicly available satellite information and models and websites and tools and expertise with communities that could benefit from this investment in ways that aren't only research, implementing it into different decision frameworks, connecting it with the public. And this could take a lot of different forms. And through the first generation of HAQAST, those connections were being formed. Through the second generation of HAQAST, they were really growing. And by the time we launched this third generation back in 2020, we realized that there were some organizations that were so consistently involved. They were leading tutorials or writing resources or hosting events. And we wanted to have a platform for us to benefit more directly from their expertise and engagement. And we'd already been kind of casually calling these people the super users. And Michael Geigert was is often our poster example of a super user. But we wanted not just to highlight these experts, but for us to sort of work shoulder to shoulder in connecting with their networks and their communities and their issues. And so over the past few years, we've launched the HAQAST Ambassadors Program. And this Ambassadors Program, we welcome anyone applying to be an ambassador. For the most part, anyone who is a stakeholder who wants to be more involved can be an ambassador. I think the only times we've said no tends to be with researchers, because the goal isn't to connect with the research community, it's to connect with other organizations as sort of the users. So what we have here to close our panel are really the voices of these super user organizations and people who've really spent the time, come to many HAQAST meetings, and they meet with Jenny and I and any HAQAST investigators who want to join us for our online meetings about 3 times a year. So what I'd like to do is to first let you hear from each of them about their experiences, who they are, what communities they've been connecting with, and why they've invested their time and energy into this HAQAST and NASA initiative. And then I have a couple kickoff questions to get the conversation started. And then what we really hope is that all of you will be asking questions and engaging their unique and diverse perspectives to think through the themes, challenges, and opportunities that have come up over this meeting. So this session goes till 12:15. We have a nice, relaxed opportunity for conversation. So as we're doing our introductions and kickoff, please be thinking about sort of where you'd like to take the conversation before we all leave here to go back to our normal lives. So I'll start here, and you can introduce yourselves.
Hey everybody, Doug Boyer. I'm from the Texas Commission on Environmental Quality. I've really enjoyed this HAQAST group over the years, and mainly it's because of the collaboration and being able to hear from not only the research side, but how other organizations like those up here are applying that. And that's sort of the world that we live in as a state regulatory agency, is how do we take this information, whatever it is, and apply it into the regulatory requirements that we have. And so that's another way that I'd like to be involved, is to try and explain those regulatory requirements and sort of the guidelines of the box that we have to live in, and how that relates to the different work that other people are doing. So that's my interest. Hopefully we can take more of this data, learn more from each other. I was just having a great conversation with Emma Nolan about some resources that she just heard about. And so how to take all that information and incorporate it into our work is what I want to do. It's hard, but that's the ultimate goal. So looking forward to this.
Hello, everyone. I'm Pallavi Pant, and I work at the Health Effects Institute, which is a nonprofit research institution trying to support and provide high-quality research on how air pollution exposures impact health. I think a little bit different from the rest of the panel here. I'm most interested in data and information that is applicable in regions outside the US, especially in places where we have significant data gaps when it comes to air quality, and then also gaps when it comes to research on health effects of air pollution. And I think the HAQAST community has been one of the big drivers for filling that data gap. I was speaking about this a little bit earlier in the morning session, so some of you heard this already, but having access to the types of data that the HAQAST PIs have been producing over the years has been really fundamentally shifting the way that we can do research in countries where ground monitoring data and other types of networks of data sets may not exist. And I think the other piece that I personally have really enjoyed about this community, and I hope this will continue, is the ability to have conversations like this. It's not just a room of scientists or a room of people making decisions. It's everyone sort of talking to each other. And every time I've attended a meeting, I've learned many new things, many new resources that I can then take and use in other places. So thanks to all of you who make that happen. And thank you to Tracey and the team for making this a very inclusive and engaging group to work with.
Hi, everyone. My name is Libby Mohr. I'm a senior data analyst at Environmental Defense Fund, or EDF. We're an environmental nonprofit that works globally on a range of issues, including climate change and air pollution. And my focus in particular is on the petrochemical industry. I guess I became an ambassador, which is really, become clear throughout this whole meeting that among the scientists and the researchers in the room, there seems to really be this really big appetite to make your science and data products useful to stakeholders like Environmental Defense Fund. And then on the flip side, at EDF, there's really this big appetite to use satellite data, both among EDF staff and among the community groups that we work with. I should have said we work with community groups, but we also work sort of on a local, state, and federal level to inform policies. And so we're interested in using satellite data for all of those applications. And so anyway, yeah, interest and appetite from the scientists to make their work useful to us, and interest at EDF in using these data. So it seemed like the perfect opportunity to sort of to be involved in this group and get the conversation going between those two groups.
Hello, I'm Allison, Patton. I'm at Health Effects Institute, so I'll not repeat the background that Pallavi provided. I work mainly on exposure and health studies. The types of questions that I'm interested in are how much air pollution are people exposed to, and where and when, and how's that affecting their health? And also, when changes are made, when policies and actions are taken, do they have the intended effects? Do they affect air quality? Do they affect exposure? Do they affect health? And so this HAQAST group, it's you're all very amazing at providing data And bridging that gap between the satellite experts and the researchers who might be experts in their fields, but don't necessarily know all the details about how to use the satellite data, which product is most appropriate. So really this group, what I really like about HAQAST is it connects data and it connects people. And so I'm really glad to be able to talk with all of you and learn from you and continue this conversation.
Hello, this is Michael Geigert, Connecticut Department of Energy and Environmental Protection. And I've probably been using satellite data for a couple of decades since MODIS. And then basically I've been just sucking up all the data I could for our regulatory procedures at Connecticut, because we have to predict air quality, warn the public, basically, and we have to do exceptional event analysis and write our state implementation plans. And before HAQAST, I couldn't put any faces to the names, right? You read papers and try to understand the research and everything, but lo and behold, I went to my first HAQAST meeting and met Arlene Fiore, for instance, and Tracey, and I presented my exceptional event analysis for Fort McMurray. I think people were kind of impressed with the analysis I did because I used every available satellite data I could find, and it was just pretty amazing. And then since then, it's just been just great to work with the group because you guys are so receptive to our needs. I mean, we need products that can, serve our purposes, serve the public, and it's just been great. It's been the best networking group that I've ever been involved with. So, I see a great future ahead, especially with Tempo, and the nice thing is that everyone is willing to help. I think that's the best thing I found about HAQAST. Thank you.
All right, my name is Byeong-Uk. I'm the manager of data and model unit at Georgia Environmental Protection Division. I wanted to be an ambassador because it sounds awesome, right? And it is. And then one thing that I need to confess is that at the beginning, I had kind of low confidence in utilizing satellite data for the really regulatory work, and then my confidence level start ramping up and never goes down, honestly, since then, because all the awesome people that I met and building a network. And then eventually I realized that I'm not just learning, then I now start delivering some of the information that some of the users need, because when you focus on your area, you may not know the little detail or nuance that eventually make a big deal at the end of the process. And I'm kind of proud and very grateful that I learned also giving information that you also look for. And I also had an opportunity to talk with several people here, even just brainstorming that eventually I believe it will help my work at my end too, and also contributing to your work eventually. So I think that with that regard, it has been really great journey, and I think it will be going forward too.
Well, thank you. So my kickoff question to all of you is, after this meeting, and I know not everybody went to every session because they're in parallel, but if you could kind of go through and name one wow moment for you from the meeting, whether it was something new that you learned or something that really made you resonate with your priorities, something that you felt you're really going to take home from the past day and a half. Good.
I actually two things that one of them is actually your presentation, Tracey, that right before the meeting that I did with our modelers looking into the past 2 weeks of the tempo data at our NO2 monitor locations. And I wanted to present it here, but then, wanted to do a little back down because there is a lot of uncertainties, but then realize that it's not just me that kind of jump into the analysis right away, even if it's a better data, it doesn't really matter to me. I just want to see the trend. And I can tell you that it was awesome that I think it's very promising, I can tell. And even that I had a conversation with my modelers that there was a blob in the Friday and was like, what happened in Friday in Atlanta? And then somebody mentioned that there was a graduation ceremony in downtown. So maybe we'll see how if that turned out to be true. But anyway, so that's what pretty impressive. And then I actually very touched by Brian's presentation and talk about not overselling should be avoided. But at the same time, I want to say this, like I said, mentioned that my confidence level kind of ramping up now. So I think it's also important not to underselling it. There is a lot of way that the satellite data can be contributing to the air quality management, one way or the other. So I guess really the crux of the problem, or maybe the thing that we need to focus on is transparent communication between the research community and the air quality regulatory community and the stakeholders, and what's available, what honestly can be delivered through the satellites, so that everybody knows that like pros and cons and what the limits are, what the advantages are, so that we can kind of have a very comprehensive information that can be delivered eventually to the public, that we want to help them keep their health to the level that we want.
Yeah, I was just going to comment on the last session I was at too, because modeling is becoming a very important part of this too. And to do efficient modeling, you have to have the emissions. And now, there's great hope now with Tempo for sure, trying to, make truth of the NEI, for instance. I mean, it's sort of a black box in a way when we look at emissions. We throw them in a model and hope they work. But for instance, the ozone levels at Connecticut that EPA does, they show us nearing attainment by now, right? They always do. And it just never happens. So I think the satellite folks here are really going to be instrumental, in tuning the emissions. And then we have the wildfire emissions. I always talk to people about that, Daniel Tong and Brad. It's like, the models don't quite get it right yet, but they will eventually. I mean, it's a complex chemistry. And for exceptional events, what EPA wants to know is, okay, well, it's easy for PM. You say a high PM, where it came from, but ozone, but we don't know how much ozone is produced in these fires. So we're sort of at the mercy of EPA saying, well, I don't believe you. So you guys are going to be instrumental in the future, the tuning the emissions, I believe. And for me, that was a big takeaway. I think we're going in that direction, and good luck to you all.
That the comment about the uncertainty in communicating what data can and cannot do, I think is very important as well. The main thing I've taken away here is just how many items that we've had on our wish lists that the HAQAST the researchers and the Tiger teams have actually addressed. Data are much more accessible than they are. They're in formats in many cases that can be easily used by health researchers. And so this is really helpful to make these data more widely available by more people, which of course comes back to being even clearer about what the uncertainties are, because the people using the data are even less expert than they were in the past, which is really great. So I really hope you'll all continue on that path of making the data available and communicating what they can and cannot do and what their uncertainties are. Thanks.
Yeah, so I think it's hard to pick just one wow. But yeah, I will say I was super excited to hear about all of the emerging ground networks at the session yesterday, and excited to see some of the data coming out of those. And I also feel like I learned a lot about the complexities of the column to surface ratio and that relationship, and just kind of realize that there are just so many different methods for estimating surface level concentrations, and that we don't necessarily know which ones are the best for different data sources. And so yeah, I'm looking forward to continuing to learn more about that.
I think I'll echo the statement that there isn't one thing, there are many wow things. Two that I would love to highlight. One is some of the works that's happening across different teams and by different people to stack data sets together, which makes it a lot easier for people who are not going to work on the direct data products to use them and to also facilitate their use in different places. Again, I'm thinking, places outside the US. That's extremely helpful and very valuable. So please keep doing it. And then the second thing, I've really enjoyed the HAQAST model overall for the last few years that I've been engaged in it. And as somebody who does work with a variety of organizations in other places, and also as an institute that funds research in the US, I think I've been thinking over the last day and a half about what does this model teach us about how to do science in a way that is really impactful and also engages people. So that's probably something I'm going to be thinking about for the next few days, and what can we learn and use for our work.
Wow. One of the things that I think that is really made me smile the most is the folks in this room hearing from these stakeholders, and one of it is like the importance of that surface measurement. We just talked about that, and satellite data has been so much about column, but trying to get to that surface information. There was so much discussion about that this meeting and these past few, and I think for us in the regulatory community where we have to deal with that at the surface and those regulatory monitors, it's so important, and so that it's great to be heard that way. The second thing to me is it's not the presentations, it's what happens afterwards. And so having those discussions with you has been the most informational for me, and developing those relationships is really important. So that's where I hope to continue, and please come ask us questions, get involved with your local stakeholders. So yeah, they can get the information that they need.
Great, thank you. And actually, so I want to say we're going to have, before we take questions from the audience, I just want to do one more quick round robin to tee us up, because I think actually it's Allison mentioned some of this and Doug a little bit, is that if you have one wish list thing, or one wish list for the future, and this might go to anybody who is listening, who's prepping their proposal, or it might just go to our NASA program managers, or it might just go to the universe. What are the things that, if you could have wave a magic wand for the next thing to come out of HAQAST or the community, what would that be? And maybe you want to start, let's start it with Doug, or move along.
Wow, that one thing that's hard. Something that just comes to my mind is many states have a lot of expertise in doing things, especially with like emission inventories. And in our regulatory world, we have to develop those and use them within our state implementation plans. If there's the possibility of using those types of inventories within other air quality models that are out there, that would be great, because then that provides those results can be more meaningful and representative of what we have to put into our state implementation plans. And that can be used for weight of evidence or things that's much more relatable. So think about that if there's ways to do that.
I think what would be on my wish list, mostly thinking about the types of work that I do, which is health, either health studies or health impact assessment, burden assessment, is identifying and reducing uncertainties in the satellite data sets, or understanding better what they are, so that when we are doing health estimates, we also have a sense of what we should be accounting for. I was really excited to see some work presented here by Marianthi and her colleagues that is starting to look at that. So I'm hoping that will expand and will help us continue to refine the estimates more.
Yeah, I agree with the note on uncertainty, definitely. Yeah, I guess just alluding to my my last comment too, I think data sets with surface concentrations or and estimates with uncertainty as well in those concentrations, or, alternatively, sort of a compendium of methods for estimating surface concentrations and kind of outlining the strengths and limitations of each. And I know, that the landscape is seems to be evolving with new machine learning and physics-based machine learning kind of methods coming online now. So I would say that would be my big wish list. My other wish list, or my other wish, I guess, which I only get one. Okay, I'm gonna ask for two and see what happens. This one probably isn't very realistic, but thinking about the future and like new satellites, I work with a lot of VOCs, and really the only one that we have is formaldehyde in satellite data, and so how just curious if it's possible to design like new novel satellites that can measure things like benzene or other kind of volatile organic compounds that have health concerns.
Right, so the uncertainty is critical. The other wish list item that I really add is many of the most impactful health studies when you're looking at policy are the type that they're called cohort studies. They follow large numbers of people over a long time period. So the more you can organize your data and make it accessible so that we can look at changes over both time and space, for people who aren't familiar with NetCDF, like I don't know how it would be possible to organize it that way. It would be, I'm sure, very challenging, but that's why it's a wish list item.
Okay, I'll only do one then. Okay. Yeah, I just wanted to elaborate on what she said, because the researchers have heard this from me before, is to make the NetCDFs uniform across NASA. And I know, for ArcGIS simulation especially, I know Matt Tisdale, I've been working with him, and that is the goal for NASA, but still there is an issue. Whatever viewer I use application, it's still an issue, whatever data set I'm using. And of course, Baron Henderson's not here in person, but he's also an ambassador. He's been very helpful with the Python code. Python appears to be maybe the way of the future now for displaying the satellite data. So that's going to be great. I mean, the interaction has been really good with the other researchers trying to get this data simulated in a form I could use. So anyway, that's always been my wish list. Make it more uniform. And maybe there'll be a universal application. I know even Aaron there has his sport viewer for the tempo. I mean, they developed that so they could quickly look at the tempo data. For me, downloading tempo data from Earth data, I have to, put it into Python and whatnot. But it'd be nice to just have a universal viewer, right? Just get every bit of data. I mean, Earth data, you download the data. But it'd be great to just make it as easy as possible. Thank you.
Wearing EPD hat, practically my wish list is to have a good explanation or correlation between the column data and the ground monitor data, so that we can eventually utilize the satellite data for actual regulatory action in a way. Taking off my EPD hat, getting a little crazy about the new future idea. As of now, the way that the Clean Air Act is written, that it has 4 elements: the indicator, form, averaging period, and a level. Now you can get a sense that somehow somebody come up with the brilliant idea of correlating indicator out of what's been measured with the satellite with a level that in a VCD unit, and the averaging period, whatever that is, even like a daytime average or whatever. Then come up with the standard that's based on satellite, then it will kind of solve every single problem that we may face now, right? So that being said, again, that's why I'm taking my EPD head here. I don't know what the EPI group eventually will pursue, because honestly, for now, every epi study that I know of, at least for the part of the next review data sets that been incorporated is already kind of having satellite component in it, because it's a fused data that the epi study is relying on. Although for in vitro study and in vivo study, you have to have a causality part of it, part of the standard setting. But again, wish list, just getting very innovative in the future. But somebody come up with some idea of connecting those dots, then maybe that's the way that eventually designing the satellite in a way that it can be directly used, sort of possibly, I wouldn't say replace, but kind of equivalent to the federal reference method that we are relying on, and even that then it will solve the major issue or challenge that we have about the spatial and temporal coverage. So it will greatly benefit not just the U.S. in that time, that it can effectively solve all the problem around the globe, I think. So again, that's off the EPD head and getting a little crazy.
I love it, solving every problem around the globe with satellite data. You heard it here. Okay, there was a question over here.
Oh, before we get to that, I also want to add, plug our Health and Air Quality Forum, where we also have this question posted, and Zach Edelman also had an answer. He's not able to join us in person, but I'll send out a link to that after the meeting.
Great.
Hello, Inarelli Morales, Air Quality Policy Analyst for Will County in Colorado. This is a question for everybody, because this is something that we've been discussing and seeing a lot, which is, what does it mean to have clean air, or what is clean air? When do you know that you have clean air? And what's the other question? Yeah, what metric is being used to determine that? So when we're talking to the public, either they don't know what air quality is, or they'll ask, well, is the air quality good in X city? And that's a complicated question to ask, because are we talking about, like, well, are you part of a vulnerable community? Are we talking NAAQS standards? Are we meeting those? Like, what are we talking about? And it gets so complicated, and it's frustrating for them to not be able to give them a straight answer. And then I guess politicians or I guess elected officials want to be able to show, hey, we have made improvement, or our air has been improved. But how do you show that? Is it trends? Is it like, what is it? How do we explain that we are getting better, or maybe we're not getting better? But there's a lot of communication or messaging around that the air quality is getting worse, but compared to what? For who? So that's just a general question for everybody.
Who wants to?
Yeah, that is a big question. And I wanted to raise the fact that Connecticut, until last summer, our major air pollutant was ozone. But if I ask my friends, hey, we had ozone exceedance, do you hear about it? Well, the media is starting to cover it a little more, but ozone you can't smell. And unless you're asthmatic, perhaps you won't react to it. But I have a feeling that maybe I'm wrong here. Maybe Texas, maybe it's different around your area, but Doug, is whether people actually recognize ozone as a pollutant anymore. I mean, when I first came to the East Coast decades ago, I moved to Baltimore from Minneapolis, right? Grew up in the Midwest. I couldn't see the sun. This is in the 70s, right? You look up on a hot summer day, you could look at the sun. It was like so obscured by smog. We called it smog back then, but it was sulfates, right? So people had a sense of air pollution. And so the sulfates have been declining. We have clear air. In fact, the visibility is great now on most days. I mean, we're not quite there yet with visibility, but if people use visibility as, for air quality, that it's been pretty good, except for last summer. When that smoke hit the East Coast, people, I mean, I was coughing. I mean, that was visceral, right? But the standard is much less than that. At the 24-hour average at 35, It's like, you know, you might or might not smell smoke. It might not affect everybody. So how do you tell people? We issue air pollution alerts that goes on the mainstream media. It's picked up sometimes, but we don't generally get a lot of calls, except when you get those big events. So anyway, I guess that was two parts. The particulates are noticed now, the ozone really isn't. Any ideas? Anybody want to comment on it? Doug, Texas, I mean.
I'm happy to talk. I didn't know
Yeah.
So I have a different role at TCQ, but it's a good question. And I've received it in different places from a lot of different people. And I think you've already hit to it, that it's personal. And someone in a large urban area is going to see something that's much different than someone that's in a rural agricultural area, or just might be visibility, like Michael said. And so I think that to answer the question appropriately, you have to be more intimate with the person that's asking it and understanding their personal situation. So that's sort of my general response. In a NACS world, I think the AQI is a pretty good assessment, and Air Now is a great resource for that.
More questions?
So I can add some based on, personal experience. So I think in part, the way to communicate the different levels of air pollution is to experience different levels. So like during COVID, I lived in an area where there was a lot of traffic, and then the traffic went away and the sky was so much bluer. Even though we had good air quality to begin with, it was just that contrast. And in the other direction, last summer with the wildfires was the first time that many people that I know experienced bad air quality. And so I know that I had family members going on the Air Now website and putting in different people's addresses, like your house is better than my house right now. And like doing this comparing and contrasting that I hadn't seen before. So I think it's about experiencing different things. But if you find a general answer like that, yes.
Yeah, I guess I'll just chime in. We sort of as a best practice when we're communicating concentrations to communities, we'll always try to put them into context relative to some sort of health threshold. And obviously the health thresholds are not perfect. You know, some of them are sort of based on like, this is the concentration at which there's a 1 in 100,000 lifetime cancer risk or something. And so it's kind of like hard to pick them because you have to like basically decide what is like an acceptable like level of exposure for people and like pick that threshold. And that's how you pick the health standards for some pollutants. But yeah, I think that is normally helpful because a lot of people don't necessarily know what 3 parts per billion of some chemical is, but it's easier to say, well, this is twice the you know, concentration at which such and such government agency has determined that there's a chronic or acute health impact.
You. Yeah, Jesse? Oh, Jenny's coming with the mic.
Well, from my perspective, another little issue is that even though there may be a standard, it also depends if you're a sensitive receptor and do you have pre-existing conditions whereby that standard is not protective enough for you in that categories.
Yep, good point.
If we end early, we can take a picture together.
Oh, the picture. We always forget the picture. Well, I want to, maybe I'll have one more for, when you're thinking about balancing these different issues. And I guess also with the surface to column issue is one, you know, how much is there the balance between the uncertainty and the methods, and this isn't exactly an observation, I mean, versus giving a simple, direct answer. And I think oftentimes the questions that come, and I think that's a great example, is how clean is the air? Or what is the surface concentration? And they don't necessarily want an explanation of statistical methods. And so I guess, you know, if anybody here has sort of the path forward between being transparent and clear about what the data are doing and the uncertainties versus layering on way more information than the audience might need.
That's an excellent question, Tracey, because that is something that we grapple with pretty much on a daily basis with some of the data sets we use and communicate. And I think, you know, the somewhat probably easy answer to this is it depends, because I think in thinking about, I'll take the example of the Global Burden of Disease study, which is a global comparative risk assessment framework, includes air quality, and we communicate about those results a lot. And there are significant uncertainties underlying those estimates, which are well understood by the scientific community, but when we communicate those numbers and data and trends to the general public, and I'm classifying general public here as people who may be working in advocacy, people that may be trying to write media articles, often what they want is the information, but then perhaps a writer that allows them to say, as you look at these numbers, keep in mind these are X or Y. So I think it's a tricky balance, but within the scientific community, continuing to be very clear on where we need methods development so that the estimates continue to get stronger and better. But in communicating to general audiences, often I would put those types of information and footnote so that if you need more understanding on where the data are coming from, what the gaps are, you can find that information. But if I start communicating to journalists that look, 100,000 people are dying, but actually it could be 50,000 and it could be 200,000. Now that's a big uncertainty range, but the journalist doesn't know what the story is anymore. And, you know, similarly, if I'm talking about air pollution concentrations, I really like the question you asked earlier about what is clean air. If I, you know, go into a lot of detail and start talking about, well, you know, the WHO guideline is 5 and the standard for this country is, you know, 9 and another country is something else. And this is where your number is. And now I've given people no information about, okay, but is it bad or good for me? So I think for certain audiences, the clean, clear, crisp message, this is the number, and trying to bring some nuance to it, but keeping the very detailed scientific uncertainty discussions within the scientific community so that the messaging is still clear is would be my take on it.
Well, I think unless, does anybody else have comments? I think maybe this is a good time to wrap, but before we move out to a closing photo, I want to just say one last thanks to actually NASA and to John Haynes and to Helena Chapman and Laura Judd, who just snuck out the door, because truly the whole HAQAST enterprise came from the visionaries at NASA, and they work tirelessly, not just behind the scenes of HAQAST, but also making sure that NASA has a presence at organizations like the American Public Health Association and the American Thoracic Society and AGU. And I think this idea that they're, for the most part, sitting quietly in their seats throughout the meeting, but they're actually doing so much work for all of us. So I just want to say thank you.